Jones.
Hi.
I'm Kayla McClain. I'm your occupational therapist today. I'm in here because your doctor has declared an OT evaluation, and today I just want to go ahead and start it. And I'm here to address these symptoms that are limiting you from doing your daily activities.
Okay.
I understand that you had a stroke recently, so I'm just going to be here to help you.
Okay.
From your chart review, I see that you're currently on nectar liquids. Is this correct? So you're having some swallowing problems. I also see that you also have orthostatic hypotension. Does this sound familiar? Okay. So throughout your evaluation today, if I ask you to sit up or stand up, I'll either check your blood pressure or I'll just ask if you're feeling lightheaded at all. I also see that you have sternal precautions. Can you go ahead and state those for me?
Yeah, I can't lift over 5 pounds. I can't push up or pull anything.
Okay, perfect. So now I'm going to go ahead and start the evaluation, and for the first part, it's just asking you a bunch of questions.
Okay.
And then we'll go ahead and get into some activities. So from your chart again, I see that you live in a first floor at your condo, and that you live with your spouse and with your terrier dog. Is this correct?
Yep.
Okay. Is your wife able to provide you with any assistance at all at home?
Yes, but she works during the day, so she's not there all the time.
Okay, thank you. How many steps does it take to get into your condo?
2.
Okay. And then I see you, it says you are independent with all of your activities of daily living, including IADLs like driving and stuff. Is this correct as well? Okay. And then prior to your surgery, did you use any adaptive equipment like a walker or a cane or anything? All right, so you're completely independent.
Yep.
Do you have a history of falls?
No.
Okay. What about any past medical or surgical history that you think it's important for me to know?
I had tonsillectomy a long time ago.
Okay.
And I have high blood pressure.
Okay. Thank you. All right, so before we continue with the evaluation, I just want to address your pain level. So on a scale of 0 to 10, 10 being the worst, where are you at right now with your pain?
Like a 4.
Okay. Thank you. Do you know what the date is today?
Yes, December 13th.
Perfect. What about the time?
It's close to 4, probably.
Close to 4. Okay. Can you name the place you're at?
Yes, I'm at Florida Hospital.
Okay. Do you know why you're here? Can you explain to me why you're here?
Yeah, I had heart surgery and I had a stroke while I was having surgery.
Okay. How about breakfast this morning? What did you have for breakfast? Do you remember?
Yeah, I had some eggs and some fruit.
Some fruit? Did you have anything to drink?
Yeah, I had some orange juice, but it was thickened.
Perfect. What about, you told me you had a wife. Do you possibly remember you and your wife's wedding anniversary?
Yeah, it's November 4th, 1989.
Okay, perfect. All right, thank you so much for answering those questions for me. Now I want to go ahead and address your vision. So before we start, do you wear glasses? Okay. Do you have difficulties with any kind of lighting? Like, is it too bright or too dim for you sometimes?
Not normally.
Okay. Can you go ahead and tell me what you see on the back of our hospital room door?
It says, "Have a nice day."
Okay. So now I want you to go ahead and I want you to follow my pencil.
Okay.
I'm just going to go in and out, and if you don't see my pencil or if it becomes blurry, I want you to just let me know.
Okay.
Just follow my pencil. Try not to move your head. Is that good? Okay, what about now?
I think it's a little blurry.
Okay. All right. So, do you have trouble reading then at all?
Yeah, sometimes it's blurry. I gotta hold it really far away to see it.
Okay. Thank you, Mr. Jones. So, now I just want to go ahead and address some functional range of motion activities, and basically, I just want to see how well you can move.
Okay.
Today, though, I'm not going to test your muscles because I know you have some sternal precautions and I don't want to break those, so we'll get to that later.
Okay.
So now what I want you to do is I want you to go ahead and just raise your arms just straight out for me if you can. Okay. Then can you go ahead and raise them to the side for me? Just out like this. Okay. So your left arm's a little bit difficult.
Mhm.
All right. Can you go ahead and try to put your arms like this behind your head, almost like you're washing your hair? So you're having difficulty bathing, showering.
Yeah, I can't move my left arm very well.
Okay. All right. Let me just see. See this. This is your jacket, right?
Mhm.
Okay. Can you put that on for me? Well, that was pretty good.
Now I can't get
your arm in this way.
Okay. I need help.
All right. Well,
once you get it lined up, though, I can.
It's right there. Oh, okay. Okay. So we got a little bit of trouble putting on our jacket. What about zipping it up? That's out of the question.
I can't do that because I can't hold this side down to.
Okay. Well, good job putting on your jacket. One more thing. What about eating? Do you have trouble eating at all?
Yeah, because I can't hold my plate and my fork at the same time. My plate kind of slides around.
Okay. Do you get tired when you eat at all?
Yeah, sometimes I have shortness of breath.
Just sometimes? Okay. Okay. All right. So now I want you to do, Mr. Jones, is we're going to go ahead and just do a little bit of transferring. If you can for me, can you just go ahead and lay down? Lay down on this bed for me and remember your precautions. All right, perfect. Any pain? Okay. Can you go ahead and sit yourself up at the edge of the bed? Okay, any pain? Can you go ahead and stand up? Good job. All right, go ahead and sit back down. Any pain with that at all?
No.
Okay.
Feeling a little out of breath.
Out of breath. Okay, perfect. So do you have trouble then walking around in your room, like to the bathroom and stuff like that?
Yeah, I get tired easy.
Oh, okay. Any pain in your legs sometimes when you walk around to the bathroom?
A little bit. They feel a little weak sometimes.
Just sometimes. Okay. So now I have just a few more questions for you. We're almost done. So now I want to talk about just like an emergency situation that might happen to you. Say you're at home and you heard your fire alarm go off. What would you do in that situation?
I would get out of the house and call 911.
Perfect. Very good. At home, do you handle your finances or your spouse?
My wife normally handles it.
Okay. What about medications? Do you take medications for your blood pressure? Do you have any problems with that?
No, not normally.
Okay, perfect. All right, Mr. Jones. So based upon today's evaluation, I just want to work on your upper body function. That way you can wash your hair, you can get dressed again, put on your jacket. And then I also want to work on your endurance since you're having a hard time getting to the bathroom and taking a shower and things like that. And you also mentioned you had shortness of breath while eating. So for therapy, I'm going to teach you some adaptive ways to make eating easier for you. And then I also want to work on your left hand function. That's important since you weren't able to zip up your jacket.
Okay.
Does that sound okay for you? All right, and so before I leave, I have just a little bit of homework for you. While you're not in therapy every day, if you can, I want you to start stretching your left hand. We'll start out simple. Just take your right hand, and I just want you to stretch your fingers. Try to do it 2 or 3 times a day, and just try to stretch your wrist for me too. This way it's not so tight, and that way when I come in for therapy, we can start working on it.
Okay.
And also a good thing to do is if you have a pen or even a pencil, just take on and off the cap like this. That'll work on small hand movements. And if you have a mechanical pencil, just pressing it up and down with all your fingers and using your left hand.
Okay.
And then Mr. Jones, since you had trouble walking to the bathroom and stuff, I'm going to ask your nurse if they could place a bedside commode for now by your bed. That way you can have access to go to the bathroom. And I'll make sure we'll come up with some type of schedule so someone's in here at all times or on shifts. That way you can use, they can help you transfer from your bed.
Okay.
And some last minute recommendations for you. Of course, I'm going to ask for a bedside commode.
Mm-hmm.
And a walker for sure, since you're having trouble with endurance right now, and a little bit of pain in your legs, and then also a shower chair again, since you're having problems with endurance. For now, we'll just start out so you can use the shower chair while you're taking a shower. And then referral for services, I'm going to request you to see an eye doctor. You might have some troubles with your eyesight. Maybe reading glasses could help you with some of your vision problems. And then also I think inpatient rehab would be perfect for you since your wife works. If you progress easily, we can easily bump you up to skilled nursing or something like that.
Okay.
So this concludes our evaluation. Do you have any questions? Okay. I look forward to working with you, and I'll see you tomorrow.
Okay. Thank you.